female talk. This is not for the men. So if you're a man, it's best to don't listen to this, okay? Because this is a woman's, female's thing, conversation. Um, it's crazy because I work in the doctor's office and I've been through so many different surgeries, and I still get like very like anxious and uncomfortable, like, in the sense of people seeing me, and I don't know. I just thought today was going to go well. I'm coming for my yearly exam, my yearly pap smear, and I've had many pap smears before, and including the one that did my surgery. He was a male, but he's an old school doctor, and he's African, but he's really good. He's a OBGYN. He delivers babies, and he also does plastic surgery. With him, he's the one that removed my dermoid cyst, that mass I had that was in my pelvis and ovaries and everything, and then he took my whole left ovary and fallopian tube out. And he did a great job, wonderful job. And he did my pap smears. He delivered my sister's baby, and he's really good. He's really good doctor, and that's where I came here to see him, because he was the one that did my pap smear the past couple of times, and he did a good job. Of course I'm always sensitive, down there, but so he went in a couple times, and he did really good. I don't remember ever really feeling a bunch of pain or or anything like that. I even had one of his female, what do they call them? The people that deliver the babies. Boy, my mind is all over the place. I'm just embarrassed still, I'll get into that in a minute. I just, what do they call them? The people, midwives. Yeah, so there was midwives that actually did my pap smears too in the past, and he had his midwife as well do one on me, and it went pretty well. You know what I mean? Now this time is the first time ever that I go and get a pap smear done, and it didn't go so well. I don't know what this woman did, because I came there to see my doctor, and I don't mind somebody else doing me as long as they know what the hell they're doing. So, I come in there, and, she's, getting undressed. She does the boobs, the exam, and it was pretty good, and I told her that breast cancer does run in my family. And, she ordered me a script for pap smear. That was fine. But then, she went down there, and I'm getting off of my cycle, and she says, okay, scoot down. I scoot down, and I'm already nervous as it is. I don't like, people touching me there and looking at me there. So, but a lot of times, I don't have the issue that I had this time. This time, she takes the speculum, and the next, she's putting it in, and it was painful. I don't know why. And I'm not saying it was excruciating, but it was worse discomfort than usual. And it was just ooh, ooh, ooh. And I'm just sitting there. She's like, oh, I'm sorry. And she's twisting it around. And I'm like, ow, ow, ooh. And I'm in so much pain. And she was like, okay, are you okay? And I'm like, yeah, I'm fine or whatever. I said, oh. And I'm just trying to have her get, the sample she needs. And then she pulls it out. I'm like, ooh. So then she goes to put her finger in me. And when she puts her finger in me, I get a stinging pain again. And I'm like, oh, ooh. It just felt extremely sensitive, like a nerve problem's going on down there or something. I don't know if it hurt. I don't know if it was just her and the way she did it, and she, you know what I mean, or I'm developing some kind of nerve pain within me. I don't know, but it was painful for some reason, and it got me concerned. She's like, oh my gosh. And she was like, I see a lot of discharge, right? And I said, well, I am getting off my period. I said, women, we get discharges every day, and especially after your period, because your body needs to clean itself out. So then I said, is there something I need to be concerned about? Like, is it more than usual? She says, no, I just wanted to ask you, but she seemed like very like nervous, because I guess because of the pain I was feeling. So I guess she felt like she put me through so much discomfort. And I said, okay, I just want to make sure. I said, because you're asking me questions as if like you don't know women get this or something, So she's like, no, I just want to know if that's the norms for you and stuff. I said, yeah. I said, I get this a lot, and especially after my menstrual, I get it a lot. I mean, what, did I have a freaking orgasm on the table or something? Like, I mean, I don't know. She was like making me worried. And she was like, okay, all right. Yes, are you okay? Are you feeling any pain? We're going to do the testing and everything. I said, yeah, I'm fine. She's like making me feel like uncomfortable and like worried. It's 7:25 p.m. So she's making me feel worried. I'm like thinking like, is there something wrong with me or whatever? And then she asked, and this is very personal, I know, she asked if I was, sexually active. And I said, no, because I'm not, So it's like, I won't mention how many years I haven't done anything, but the point is that no, I don't know if that's what it is, maybe. And maybe she's so used to just jamming shit up in women because they're sexually active and they're opened. I'm not. So you know what I mean? Like, she's maybe that could have been it. Maybe she used a very big, large speculum, and then I felt like she cut me or something with that thing. I don't know. And it was like, I started getting worried. I said, what if she cut me with that thing and it was just too large for me or something? I don't know. I just felt like maybe she was inexperienced. She was young. And, she's like a nurse practitioner. I know she's not a doctor, but, I know she's got to be like a nurse practitioner, either a midwife. But I'm like, woman, you're gonna have to calm down with those hands, because she was just feel like she wasn't like as gentle as like the other doctor. Because last year I didn't have that problem, and I wasn't sexually active then either. So I don't understand. Like, it must be either I have a nerve pain developing there, or either it's her and she just was being too rough. Maybe, I don't know. Like, and I looked online, I started getting anxiety. I said, oh my gosh, she's like, I feel embarrassed. And not just that, but I feel like I have anxiety. Like, what if I have like a cervical cancer or something? Or like, what if like, like she scratched me and I got an infection. I start thinking all these horrible things, what if like, she like put this large thing. So I looked up online, and so they said that sometimes there's different sizes for these speculums, and there are some that are too large and some are small, and it did hurt more this time. I was like, okay, this is not the norms for me. I never felt this before, so I don't know. I think maybe she used the wrong size. Maybe I don't know. I mean, it just hurt really bad. It's horrible, and I don't even want to go back to have another one. But I mean, like, I'm sure everything will come out fine. Let's just hope there's no precancerous cells or anything like that. I mean, I don't know. Maybe it's a nerve pain. I was looked up online, different reasons to why a woman would suddenly feel pain after she's had several pap smears all throughout her life. Like, is my hormones changing? They said that it could be pelvic floor muscle issues and tension. I did feel a little tense, maybe, because it wasn't the doctor and I was worried who I was getting. I don't know. But like, she started giving me anxiety, and I'm like, is everything okay with me? Am I have a cancer or something? Is there something going on down there that I don't know about? A nerve issue developing? I have pain down there? I don't know. It's like when she just put her finger even in the tip, and I started feeling the pain, and I don't know if it's because of a nerve or either I got cut by that speculum that she put in me. I don't know, but it was painful. Or it not like my past experiences. I don't know. I didn't like that. I was like, ooh. So she couldn't even finish the exam because it was just pain. Like, I felt like it was just very uncomfortable and painful. So she said, okay, we won't do if you're feeling pain. So she just, she just took her glove off. And I'm like, well, but what if like there's like a painful like lump developing, there's cancerous or something? That's what I started thinking to myself. Like, what if like I have a painful like cancer developing there and a nerve, and we don't even know because we could have finished the exam. So she just wrote out her. I just think that maybe she was just being too rough for her hand or something. I hope that's all it was and not something else like a nerve pain. But I looked online. They said there's several reasons to why it could be your hormones are changing. I have been feeling very tired lately. I've said this. I've been feeling extremely tired, and just I don't know, like my energy is lowering, and I think it has something to do with my age. I don't know. I'm not dry. It's definitely not dryness. They were like, it could be vaginal dryness. I don't have no dryness because she said a lot of discharge. And, so I know it's not that. My hormones are shifting around. It could be muscle tension, pelvic floor issues. It could be that, like they said, that it was too big of a speculum that they used, and I need a smaller one. And I mean, then when after when that happened, she says, "Are you sexually active?" And I said, "No." And I was like, "Oh, okay." And I'm like, "Well, what would you guys just get the biggest speculum and just just shove it up in somebody? I mean, like what the hell?" I don't know about other females out there what your experiences are with OBGYNs, but now I'm like, I don't want to go back to one because that was painful. I mean, unless it's him, that doctor, I don't know. And, I was very sensitive. Like when she touched me, I was like, oh, I think I was just that too, because I'm not, I don't get touched like that. So I don't know. I think I was just very, anxiety driven. And, she went and put that thing in me. I don't know. It's just weird because I've never felt that before. I've had pap smears and all sorts of things, no problem. So I'm like, either I have a developing nerve pain issue or some lump that maybe is cancerous, or either it's a tumor, or either she just don't know what she's doing. I don't know. I just don't know, because I never had a problem with them doing those exams on me before. I'm like, I really came there to see the other doctor. She looked new, so I don't know if she just was new at this and maybe she just needs to be a little bit more gentler. I feel like if she was a little bit more gentle, I felt like it was more rushed. That's another thing too. I felt like it was very rushed this time versus the other doctors. They do it gently and slowly. And I don't know if she used anything on me. I don't think she did. I thought they were supposed to use like a lubrication. I don't think she did with this. And the speculum, I don't know what size it was, but it was just, I'm going to check myself. I want to make sure she didn't cut me or something. I felt, even when she twisted, I was like, I felt like it was scraping me. I was like, ow, I don't know. Oh boy. I'm like, oh, never again. I don't want to get her next time. I want with the other doctor next time. I'm gonna have to do my own self-examination and make sure, is it me? Is it painful when I do, or it was just her and her hands and her are being rough or whatever? Because maybe she's new at this or so. I don't know. But I'm like, no, that was so painful. I'm gonna go look up online and make sure there's nothing wrong with me. I mean, most women that probably go in there are sexually active probably, and they're very opened out there already, and they're used to stuff, being all up like that. But, so maybe that she was just so used to jamming things up in people. I have no idea. I don't know if that's the reason. I don't know. I have no idea. Oh boy. That was not a good experience. I was very embarrassed, and now I'm like, oh boy, I don't know if I want to go back now. It's like, oh, in another year, I'm like, oh no, do I have to deal with this again? But I'm kind of not satisfied because I feel like she didn't do the full exam. And so I'm like, what if there was a lump or something that I don't know about as a tumor, or, it would have been completely missed. Maybe they should do an ultrasound or something on me down there. That's the thing. I've had ultrasounds, transvaginal ultrasounds, when I had to check that mass, that dermoid mass that I had back in 22, and they had to put that in me. That was horrible, but I didn't feel that kind of pain. They put a scope in you and it's a camera and it can see like your ovaries and your reproductive organs. I didn't have a problem then. So I'm like, what's going on? Like, I don't understand. that like left me like wondering, like, okay, I don't know. I don't like when things like that happen when I've been doing it for so long, and then you're like, why did that happen out of nowhere? And you know, I looked up online, so I'm gonna look up some more online tonight, like about that. I don't know. And then she looked very anxious. So I'm like, is everything okay? Like, did something happen? Or did I have a freaking orgasm on the table and I know it or something? Or, you know, like, or is it just was normal discharge from my monthly flow? Cause I am getting off my period, you know? So I'm like, I have no idea. I mean, you know, she's like walking around like, yeah, everything's fine. And she's taking her gloves off. I'm like, is everything all right? Why are you looking at me like that? Oh boy, she had me embarrassed. Cause like, she's like, yeah, it's a lot of discharge. Do you normally get that much discharge like that? It was like water. I'm like, well, I do get discharge every day. I mean, you would want to because your body needs to clean itself out. What was it? I mean, I'm getting off my period. Is it like the way she made it seem like an explosion happened or something? Like, you know, that's the way she made it seem like. Yeah, she was just sitting there walking around, like, you know, looking around like anxiously. I was like, is everything okay? I mean, like, I don't know. Oh boy. I'm like, I hope that's not what happened. Like, these are the things that's running in my head right now. Like, I'm embarrassed. I'm like, what if I like had an orgasm on the table or something? The way she was making it seem like loads of like liquid, like water, just like gushing out of me or something. Like, it was just weird, you know. That's my neighbor there. Oh boy, I don't know about this, you know. I'm like, I don't know, I don't want to come back there because I'm like, I don't know what happened on the table. Because like, she just looked like, you know, her eyes. You know, she was like, well, we're done. Do you normally get that much discharge? And she was doing this with her glove. She's like, do you normally get that much discharge like that? And I'm like, yeah, I mean, I do get it every day as I'm getting off my periods. Is there something I need to be concerned about? No, everything's fine. And she's putting her gloves off. And I'm like, okay, like, you know, you're making me feel weird. And then she's like, well, here's your, she looked at me like, that's exactly like she was staring at me. And I'm like, is everything all right? Like, well, you're not telling me, you know? And she's like, giving it to me. She's like, here you go. This is your script for your exam. We'll see you next year. And I'm like, okay, well, you know, I'm like, all right, like, thank you. And I'm like leaving, and she's like, yeah, the door's over there. Yeah. And I'm like, okay, have a good day. And I'm like, okay, like, you know, that is so strange, you know, like, the discharge part is what got me. Like, you know, I'll go upstairs real quick. I'm like bamboozled, like, okay, like, you know, I did, because that never happened to me during my exams. So I'm like, okay. Oh, I mean, I drank a lot of water today too, but I'm like, oh no, I have no idea, like, you know, how my body reacts to touch and everything. You're touching me and I'm twitching and everything. Before she even got inside of me, like, she touched the side of my legs and I started like twitching, like, you know, maybe it was just nervousness or something. I don't know. Oh. Hello. Hey. How's it going? Oh, long day. Long day. Doctors and yeah. You're out here chilling.
I know, you know, it's a nice day. It's not too hot, not too cold.
I know. Feels nice. Have a good night. Oh boy. It's her neighbor. Oh. Yeah, she just like, you know, she's like, everything, I said, did everything look okay there? She's like, yeah, everything looked fine, yeah. And I'm just like, okay. Like, what the, you know? Hey, baby. Want to live? Want to say hi? No? Oh, boy. Yeah, so, yeah, so she just made me. Oh, boy.
on there. I gotta go out. Oh, what's going on with this? It's not coming up for some reason. All right, I'm back. I don't know. My camera kind of went out for a bit. All right. Yeah, so that was something else. Like, I think that's what really got me was the whole after I felt that, and she was looking, she said, "Oh my gosh, you have a lot of discharge, like a lot of like liquid." And I'm like, okay. I'm like, we all women get this. Is how much discharge are you talking about? And she was looking at me weird. She comes out and she's like taking her gloves off. She's like, "Oh, um, do you normally get this much discharge?" And she's like looking at me, and I'm sitting there concerned. And I'm like, "Yeah, I do get discharge every day." I said, I mean, I'm getting off my menstrual. I said, "Is this something I need to be concerned about?" Like, how much like we're talking about? She's like, "No, I just want to know if it's normal. Then you're fine." Yeah. And I was just like, okay, like she's freaking me out, like as if she saw something like happen that I'm not aware of or something, like I hope I didn't get like some kind of involuntary kind of orgasm something on the table. I started thinking all these things in my head, like like what was it, like an orgasm kind of discharge? Is that what you're talking about? Like what type of discharge? You said it looked normal, so like what's going on? I'm like, oh gosh, I hope that didn't happen, because that's embarrassing. I have to go back there another year. But I went the other doctor. I don't know. I didn't have that problem with him, you know? And supposedly, like if a woman gets anxious or they're nervous or something like that, things like that can happen to you. So I don't know, but it's just weird. I'm gonna see for myself. Am I feeling pain, or was it just her and I was just nervous or something? I don't know. Oh gosh. Oh boy. Oh gosh, I don't know about another year from now. I don't know about that. I mean, unless it's him, the male doctor, because he knows what he's doing. I mean, he's done them. But I've had midwives do it before. Never had this problem. So I'm gonna look online. I'm gonna say, there's something wrong. Maybe I'll look up something like OBGYN said she saw too much discharge coming out of me while they were putting a speculum up in me, and is that normal? And I felt pain and all this stuff. I don't know. Like I have no idea. Like then I thought, like, what if I have a cervical cancer and now it's producing all this liquid and stuff inside my body, and this, I don't know. I mean, I have a lot of cancer out of my family. I've said this before, like, starting my mom at 35. I'm 36, turning 37. I have to set this mammogram up. And then on top of that, my grandmother had, I think cervical cancer. She did have cancer in her like reproductive organs. And then she had blood cancer. She did have that kind of cancer. There was one more cancer. She had two cancers of her reproductive organs. I think it was cervical, and I thought the other one was either ovarian or uterine. I have to ask my mom again. And she had some kind of other cancer. There was blood cancer or something. And then I know my great grandmother had died of cancer too. She had leukemia. And my mom had tongue cancer that was going in 22. And she had breast cancer when she was 35. That's going back in the early 2000s. So every woman down the line had cancer. So then I started thinking, like, is it that? I mean, as embarrassing this may seem, I would rather it just be I had an involuntary like orgasm or something. I just wasn't aware of it. I'm not trying to have cancer, but that's still embarrassing, Like, I mean, I'm in there and doing that. I'm like, oh, this is crazy, I don't know. Like she was staring at me like she saw something she don't ever really see in general. Is like she was just like, oh, she was just taking the gloves. Do you normally get that much? Okay, well. I said, did everything look okay? Yeah. But she didn't feel in me, like, because every time she felt me, I would get extra sensitive. Like I would, like, you touch my leg. Oh, like I start jerking. So then she was like, okay, let me, okay, just relax, whatever. So then she went and tried to put her hand, a tip of her hand there. And and maybe I was just very anxious, and maybe maybe it was a mind thing. And I thought maybe it made me feel like it was painful. I don't know. I mean, I don't know. She went and tried to put her hand as and I said, okay, let me stop then. All right, I'm not gonna do it no more or whatever. And I'm just sitting like, oh my gosh. But I mean, again, why her and nobody else? So I don't know if it was just specifically her, you know. I guess I'm gonna have to do my own self-examination, judge for myself. I mean, I don't know. I just hope that it wasn't what they said, where it was a big speculum. They said that some of them are big speculums and they're too big for you and they can cut you and stuff. And then she asked if I was, doing things. I said, no, I'm not sexually active, you know? I don't do that. No. And so she was just like, okay, oh, okay. And then that could maybe explain some of the things. But then again, last year I didn't have that problem. And it was a male doctor, the one that did my surgery and did a good job. And, he was gentle and he was, comfortable, and I thought he used some kind of lubrication. I thought he did, her, I don't remember putting anything on there. And I thought they did. I mean, I don't know. I thought they did, but I would have to look up online and see again. That was painful. Woo! It felt like somebody was cutting me there or something. Like, ah! Oh boy! Oh, I'm like thinking like she cut me inside or something, and she like twist that thing like ah! And I'm thinking that it's very possible it could be developing nerve pain there inside. I don't know, but it was just weird. I'm like, I have no idea. I'm like, I say I don't like when like when you don't know the direct answer to something, it bugs you. And it's like I like to just know exactly what it is. Was it her, or was it just my body's changing, or I was just overly anxious and maybe everything felt just overly extra sensitive to me. I don't know. So oh boy, maybe another year don't forget me. I'll be a new doctor there. But I want the doctor that did me. And she came and says, do you mind if I do your exam? Yeah, let's get this done and over with. And I'm just like, okay. And I'm like looking around for my doctor, the one that normally does it. She does it. I'm like, okay, maybe she's new and maybe inexperienced. I don't know. But that was not fun. That was painful as hell. It makes me not want to have another pap smear again. But I know I have to do it every year. But yeah, that's my female talk for the day. Yeah. I mean, I don't know if any of you women out there have had that same experience or a lot worse. I don't know. But this was like a bugger to me because it was like the first time I ever experienced this. I gotta go get something to eat and just calm down. Maybe have some glass of wine or something. I'm gonna tell my husband, I'm like, I don't know, that was just weird, But take care, everybody. Have a good night. Have you any women out there who want to share or relate? I mean, tell me, did you have that same experience where you just out of nowhere one day, 1 year out of all the years you ever got these pap smears done, had this kind of issue? That's crazy. Take care, everybody. I'm going to get off